Hello and welcome to the 2019 Open Enrollment Employee Presentation. My name's Melanie Denning, and we appreciate you taking the time to attend today. If you're attending via webcast, these instructions were needed in order to let everybody be able to hear in an easy way. Since you're listening over the internet, this slide does not apply to you. You should have received a postcard detailing the dates and times of the live open enrollment webcasts and how to access the recorded presentation. The 3 live webcasts will be held Tuesday, October 16th at 10:30 a.m., Wednesday the 17th at 1:30 p.m., and Thursday, October 18th at 9 a.m. As an alternative to attending the live webcasts, employees may view an anytime recorded option on the HCBD website after October 16th. Employee open enrollment booklets will be mailed the week of October 19th. The open enrollment booklet is also available on the HCBD website at www.benefits.mt.gov/open enrollment. Open enrollment will be held October 28th through the November 10th. Employees who wish to make changes to their state plan benefits, including enrolling or re-enrolling in flexible spending accounts or the Vision Hardware Plan, must complete their open enrollment elections by November 10th and will do so online this year using HCBD's new benefits enrollment system, Business Solver. More information will be provided in the next few slides. You will receive numerous communications from HCBD regarding open enrollment. There will be postcards mailed, posters hung, open enrollment booklets mailed, numerous reminder emails, and you will have the option to participate in one of 3 employee webcasts. A website banner will be added to the Mind site, and pop-up reminders will happen during open enrollment period. All information necessary for open enrollment is housed at www.benefits.mt.gov/open enrollment. During and after open enrollment, other important documents will be coming from HCBD, including the 2019 WRAP Plan Document, or WPD, which outlines everything that is covered and all plan details. You will also receive a summary of benefit coverage, and this is a legal document required by the Affordable Health Care Act. It is a short summary of our plan, a Medicare Part D creditable coverage letter, and a few other legal notices. Remember, the State of Montana Benefit Plan, or State Plan, is self-funded. The State Plan is funded by monthly employer, employee, legislator, and retiree contributions. The contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims. In 2016, transparent pricing, which is also known as reference-based pricing, was implemented, and it allowed us to control the cost of health care while maintaining quality, predictability, and fairness. We called this new way of reimbursing providers transparent pricing, but it was really the introduction of what many in the healthcare industry call value-based care. In 2017, we saw the medical trend, or expenses, decrease, coming in at $130 million compared to $137 million in 2016. In 2017, Navitus became the state plan's pharmacy benefit manager. Navitus allows for a full pass-through transparent pricing model that ensures the state plan receives all rebates and reimburses pharmacies the exact amount paid by the state plan. In 2017, we saw prescription trend, or expense, decrease, coming in at $25 million compared to $32 million in 2016. Dental-related expenses remained stable at $8 million. And when you balance our income with our expenses, you get the state plan reserve. State plan reserves are needed because we can't control all of the variables surrounding operating the state plan. We are able to control many of our plan costs, but there are some things we don't have direct control over, including our largest income source, the employer contribution. The employer contribution is set by the legislature every 2 years. HCBD provides funding recommendations, but ultimately has to comply with the funding set by legislature. The employer contribution has not changed in 2 years and will not change in 2019. Federal mandates also directly impact state plan expenses. For example, last year the state plan was required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, ACA. HCBD works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims in a given year, but there can be surprises. Medical trend, the increasing cost of medical care, is a huge variable that the state has little control over, and it can sometimes be difficult to predict. The cost of medical procedures and prescription medications continues to rise year after year. For example, year to date, the state plan has seen a dramatic increase in the number of large claims, as well as the dollar amount associated with those large claims. This year alone, we have one claim over $2 million and 3 others over $1 million. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. As noted on the previous slide, HCBD is progressive and works hard to develop and implement cost-saving strategies to keep the employer, the employee, legislator, and retiree contributions stable. The combination of all cost-saving actions, transparent pricing, the Navitas PBM, the new Medication Therapy Management or MTM program, increased efficiencies at the Montana Health Centers and other, has allowed HCBD to minimize the financial impacts to all state plan members over the last few years. While progress is being made, money has been saved. Now that we are more than 2 years into transparent pricing agreements with the hospitals, HCBD believes there is an opportunity to do even more to control costs. We will be asking our hospital partners to look even more closely at pricing, and we ask that state plan members look at any care they might have outside the state and, if appropriate, consider keeping it within our in-state partners. HCBD will continue its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising cost of health care on behalf of all state plan members and the state of Montana taxpayers. Employer and employee contributions will remain the same for 2019. HCBD is pleased to be able to make this announcement and would like to highlight that this is the 3rd year the state plan has been able to pass on a $0 increase to the state of Montana and its employees. This slide reflects the medical, dental, and vision hardware rates for 2019. Again, there is no change in rates for 2019. In addition to no rate increase, we are also pleased to announce that there will be no change to the medical plan out-of-pocket costs. That means medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2019. You can refer to the Open Enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. This slide reflects the fees associated with enrollment in a flexible spending account, or FSA. Please be aware that the Healthcare and Benefits Division is currently engaged in the RFP process for a flexible spending account vendor. The current contract with Allegiance expires at the end of the year, so the vendor and fees associated with FSA could change effective January 1st, 2019. If you elect to contribute to an FSA, watch for additional information from HCBD in regard to who the FSA vendor will be in 2019 and any associated fee changes. Even if a new FSA vendor is selected, the annual contribution limits will not change. The medical plan FSA limit for 2019 will be $2,650, which is a $50 increase over 2018, and dependent care daycare FDA limit is $5,000 per household. Employees must elect or re-elect coverage during open enrollment for both flexible spending accounts in order to participate in 2019. The biggest problem employees have with the new plan year starts is that they have failed to elect or re-elect FSAs and/or the Vision hardware plan. This slide reflects the insurance premiums for life insurance and long-term disability. There are no changes in these rates. Premiums for employees who elect employee optional life are currently withheld on a pre-tax basis. By withholding these premiums on a pre-tax basis, it requires the state to impute income which an employee elects more than $36,000 in life insurance coverage. This then results in the employee paying additional FICA, state, and federal tax, as well as the state of Montana as the employer paying additional FICA tax. HCBD has researched the impact of imputing income on the optional life insurance coverage and found that 93% of employees are taxed at an imputed income level that's higher than the actual premium associated with the coverage. Therefore, effective January 1st, 2019, employee optional life premiums will be withheld on a post-tax basis, which will eliminate the need to impute income for this coverage. Please remember, the state plan members, including dependents, cannot use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered on the state plan, including dependents, gets hurt or sick while working, state plan will not provide coverage, even if you have a work comp waiver. HCBD has seen an increase in appeals regarding work-related injuries due to no state plan coverage. Please make sure that you have proper insurance coverage in place to cover work-related injuries. For those of you considering retirement, remember, you may have the option to stay on the state plan, but you may also have other options that may be more financially beneficial than staying on the state plan. This includes the health insurance marketplace if you're under age 65, and Medicare supplements or Advantage plans if you're over age 65. For more information on those, contact the State Health Insurance Program or SHIP representative in your area by calling 800-551-3191 or the Agency on Aging, Rocky Mountain Development Council at 406-457-7368. Also, if you're considering retiring soon and plan to stay on the state plan and will be over age 65, you must have Medicare Parts A and B automatically enrolled in Medicare State Plan Part D prescription drug coverage. Retirees may not sign up for any other Part D coverage. If they do, they will not be allowed to stay on state plan benefits. This year's Live Life Well incentive deadline is October 31st, 2018. Don't miss out. Hopefully, you've already completed a state-sponsored health screening. We have sent many reminders. Don't forget this year you must complete all 3 requirements to earn any of the incentive. Once you complete a health screening, it will automatically be reported on the MyActive Health website. It takes about a month from the date of the screening to show up on this site. However, to earn the incentive, you must also self-report your nicotine status and the next step activity on the MyActive Health website. Even if you did a wellness challenge like the Governor's Stay Active Challenge, you still need to self-report it in the MyActive Health website to earn the incentive. And if you are not nicotine-free, but you completed an alternative like a nicotine cessation program, you have to self-report that as well. You should self-report your nicotine status and the next step activity as soon as they are completed. You do not need to wait for your health screening activity to show. Additional instructions are available at benefits.mt.gov/incentive, but if you're ready to self-report, go to myactivehealth.com/SOM. If you have any questions about the Live Life Well Incentive Program, please go to benefits.mt.gov/incentive. If there's a medical reason that you can't do any of the parts of the Live Life Well Incentive, there are exceptions and alternatives available. Call the Healthcare and Benefits Division to learn more, or email us at benefitsquestions@mt.gov. The Live Life Well program will restart November 1st, 2018, and the 2019 Live Life Well Incentive Program will be exactly the same. Additional information has been included in the open enrollment booklet and on the HCBD website. The website will be updated with next year's program information after November 1st. Open enrollment this year, the period runs from October 28th to November 10th. This year, all state plan members, employees, legislators, and retirees will complete open enrollment elections online or via a mobile device. The open enrollment booklet contains important information you need to know about completing your benefit elections, and the booklet will be mailed on October 19th. It is also available on the HCBD website. The open enrollment system will open starting October 28th. All open enrollment elections must be completed by November 10th. You will have access to HCBD's new enrollment system business solver via the HCBD website at www.benefits.mt.gov. If you access the enrollment system via the State of Montana network, you will not be required to register for an account, and you will be able to access the system using Single Sign-On, or SSO. Additional information will be provided in the coming slides. During open enrollment period, you can make changes to coverage like enrolling or waiving the state plan. You can change life and long-term disability elections. You can also add or delete dependents from the plan. However, if you want to elect or re-elect the vision hardware plan and plan to enroll or re-enroll in the flexible spending account, medical, or dependent care, you must complete open enrollment. Again, if you do not complete open enrollment election, you will have the same medical, dental, life, and long-term disability coverage you currently have in 2018. If you do not complete open enrollment election, you will not be enrolled in a flexible spending account, and you will not be enrolled in the vision hardware plan, even if you had coverage elected in 2018. The open enrollment period is also a time where employees can elect to be joint core. If you and your spouse or domestic partner both work for the state, are eligible for benefits, and have dependent child or children covered on the state plan, you should be joint core. Being joint core means you have one shared family max out of pocket, and the rate is better than being employee and children and employee only. For more information, contact HCBD. If you do not wish to make any changes to your current coverage, or elect or re-elect flexible spending accounts or the vision hardware plan, you do not need to do anything during the open enrollment period, and you do not need to complete anything online. However, remember, if you do not complete the 2019 open enrollment election process, you'll have the same medical, dental, life, and long-term disability coverage for yourself, spouse, domestic partner, and/or dependents in 2019 as you elected in 2018. Please contact Healthcare and Benefits Division at benefitsquestions@mt.gov or via phone at 1-800-287-8266 if you have questions. Remember, all open enrollment elections are due by November 10th. Big changes are coming. HCBD is implementing a new benefits enrollment and administration system, Business Solver. This replaces the SABR's open enrollment functionality used in years past. The Business Solver system will be used for the 2019 open enrollment by all state plan members, including employees, legislators, and retirees. With the new Business Solver system, state plan members will also have the ability to complete open enrollment elections online or via their mobile devices 24/7 from October 28th to November 10th. The new system is flexible and easy to use and secure. Login instructions are included in the open enrollment booklet, and the link to the enrollment system will appear on the HCBD website on October 28th. Feel free to contact HCBD if you experience any issues in accessing or using the new system. The new Business Solver system is user-friendly and easily accessible. To access the new system, simply go to benefits.mt.gov and click on the Open Enroll in Montana picture. This link will not appear on the HCBD website until October 28th. Once you click on the Open Enroll MT picture, you will be prompted to register. Since you will be a first-time user, click on Register. However, if you access the system via the State of Montana network, you will not need to register, and you will be able to be using single sign-on, which will result in you immediately being prompted to the Let's Get Started screen. But if you are not accessing the system via the State of Montana network, once you click Register, you will be prompted to set up a username, password, and security questions. The state plan's company key is State of Montana, lowercase, no spaces, and will already be pre-filled in. It is case sensitive. If accessing the system via the State of Montana network, or when you complete your registration, you will be asked to consent to electronic signatures. This will only happen the first time you access the system, and after you click Continue, you will be transferred to the home page that will be available to you each time you access the system. Once you are transferred to the home page, click Start Here. You will follow the instructions to complete your open enrollment elections from here. You must complete your open enrollment elections by November 10th, and the system will show you the time that you have remaining to complete your enrollment. Once you begin the open enrollment process, you will be prompted to review the personal information we have on file. Most personal information for State of Montana employees is retained in the Montana Information Network for Employees, or MINE site. If any of the information shown on the personal information page is inaccurate, with the exception of your marital status, you must update your personal information maintained in the MINE site. If you have questions on how to update your information on the MINE site, please contact your Human Resources Department. You will need to indicate your marital status on this page before you click the Next button. The next section is for dependent information and allows you to make dependent information changes and to add or delete dependents. If a dependent is listed on the dependent information page, the member will be able to enroll that dependent on state plan coverage on the enrollment tabs that follow. Remember that coverage will be effective January 1st, 2019. You will then click through each benefit section, electing or waiving coverage and selecting selecting dependents that would like to be enrolled. Once all elections have been made, you will be prompted to confirm your elections and agree to the bi-weekly payroll withholdings. If any additional action steps are required, based on the elections that you have made, such as dependent verification or evidence of insurability, you will be prompted to complete the action required. If you are unable to complete the action at that time, you can click the Next button, and the system will remind you at a later date that there is an outstanding action required in order to complete your enrollment election. If you fail to complete the enrollment actions, coverage will not be effective for the requested changes or enrollments. Be sure to address your actions required. Once complete, you will be taken to a confirmation page and can then print a copy of your elections by clicking the Print Benefits Summary button in the top right corner of the screen. The Message Center will house the copy of the confirmation notice. The Message Center will also be used to provide you with other important state plan communication, such as reminders about dependent verification or evidence of insurability. You will receive an email when your 2019 benefits summary has been finalized. However, you can access this summary at any time by logging into Business Solver system and clicking on Benefit Summary. Watch for the email and go online to verify that we have enrolled you correctly for 2019. Starting January 1st, 2019, you will be able to use the Business Solver system for all state plan enrollment needs. For example, employees will use the Business Solver system to complete their initial enrollments, mid-year enrollment changes, or update beneficiaries. Be sure to watch for more information regarding the exciting changes coming January 1st. The next few slides provide examples of what Business Solver will look like after January 1st, 2019. This slide and the next slide are an example of how the system will look for a new hire that is newly eligible for benefits. This is the top half of the home page for a new enrollment. And this is the bottom half of the page. If you are already enrolled in benefits, you can access benefit information in the new system throughout the year. This slide shows where an employee may update their benefit enrollment in the event that they have a beneficiary change or qualify to make mid-year changes such as birth, marriage, or divorce. The state plan currently has eligibility rules that are tied to the payroll calendar. With the implementation of Business Solver, it gave HCBD the opportunity to evaluate those eligibility rules and make changes that better reflect the needs of our members and better match how other plans operate. The first eligibility rule or issue that was addressed was regarding new hires. New hires coverage will still be effective the date of hire if they enroll for coverage during the initial 31-day enrollment period. However, contributions will be collected starting the date of hire versus the first day of the pay period in which they're hired. This will allow members to pay for the coverage they actually receive and not for days that they are not enrolled in coverage. If an employee does not elect coverage during their initial 31-day enrollment period but does decide to elect core benefits, medical, dental, and basic life mid-year, then coverage will be effective the first of the month following the date of enrollment. These types of enrollments will now be able to be completed using Business Solver. When an employee experiences a mid-year change, the effective date of the change will now be effective on the date of the change if the employee is enrolling on coverage. For example, if an employee gets married and elects to add coverage for the new dependent spouse, coverage will now be effective on the date of marriage, as long as the mid-year enrollment is completed within the 60-day enrollment period. 2. The effect will be effective at the end of the month following the mid-year change if change is being terminated. For example, if an employee gets divorced, coverage for the ex-spouse will be terminated at the end of the month in which the divorce occurred. Mid-year changes will be completed using Business Solver starting January 1st, 2019. And remember, if you experience a mid-year change such as marriage, divorce, loss of coverage, gaining coverage, and you need to make changes to your state plan benefits, you'll have 60 days to make the change. In the event of a birth or adoption, you have 90 days. Please don't delay completing mid-year changes. You will lose out on the ability to change your benefits if you miss the deadlines. When there is an employee death, employee coverage will terminate on the date of death. Coverage for the covered dependents will continue to the end of the month following the date of death. If on or after January 1st, 2019, you plan to terminate employment with the state of Montana, or you wish to terminate benefits mid-year, you'll need to be aware of some important changes to the state plan's termination rules. State plan coverage will now end the last day of the month in which an employee is employed. The termination date no longer follows the payroll calendar. This will affect any employee who terminates employment and coverage on or after January 1st, 2019. For example, state plan coverage will terminate January 31st for an employee who terminates employment on January 15th. In the event that an employee qualifies for a grandfathered month of coverage, the coverage will end the month following the date that the employee terminates employer coverage. For example, state plan coverage will terminate February 28th for an employee who terminates employment on January 15th and qualifies for the grandfathered month of coverage. Contributions for coverage will be collected from the final paycheck. Employees will not be able to waive coverage mid-year if the employee is enrolled in the pre-tax plan. If you have any questions regarding when coverage will terminate, please contact HCBD or your agency HR payroll. The new Business Solver system will allow for automated billing in the event an employee does not have enough in their paycheck to cover their biweekly contributions, or is not currently collecting a paycheck. For example, those in a leave status such as FMLA or seasonal leave. If an employee does not have enough in a paycheck to cover all contributions, nothing will be collected and the employee will be billed. Coverage will be terminated if the employee fails to make the payment. They will be provided a 60-day grace period. Contributions will be attempted to be collected on the next pay period if the member is in arrears. HCBD will no longer just reduce coverage and continue to carry account balances from pay period to pay period. If an employee is on leave and does not have enough in a paycheck to cover contributions, they will need to pay attention to the billing they receive and promptly make the payment. Business Solver will also be used to handle the following state plan functions. ACA reporting, because in 2020 employees will use the system to access 1095 reporting. Dependent verification and EOI. The system will automate the process for members needing to send in dependent verification documentation or complete evidence of insurability. If this applies to you, you'll want to pay attention to the reminders that you'll be receiving from Business Solver. Tax defaults. All spouses will default to pre-tax deductions, and all domestic partners will default to post-tax deductions. You will not have the option to change those defaults. If you have made a different election for 2018, it will be changed to the default effective January 1st, 2019. The Department of Justice Motor Vehicle Division has asked HCBD to help in providing updates on Real ID. The Motor Vehicle Division will begin issuing Real IDs in January of 2019 and will allow individuals to schedule an appointment to apply for a Real ID. Your current unexpired license or ID will continue to allow you to fly domestically or access a federal facility until October of 2020. Refer to the Real ID website for additional information at www.mtrealid.gov. On the website, you will find all the latest information, an FAQ, as well as locations that will be offering Real IDs starting in January 2019, and the costs. If you're looking for more information on your benefits, please feel free to contact the Healthcare and Benefit Division staff with any questions or concerns at 800-287-8266 or benefitquestions@mt.gov. Thank you.